go. All right, here we go. Video. Hi, my name is Carrie. I am doing a video for the cardiovascular, the lung and the thorax assessment. This is Rita DePalma. Rita, if you could tell me your name.
Rita DePalma, 4566.
Date of birth. Date of birth?
4566.
Thank you. Okay. Let me do a little hand washing here, and then I want to check this and make sure that I've got you right where I want you. Yes. Good. Perfect. Okay.
And yes, I give permission to be taped.
Yeah. All right. Second go around here. So yes, for purposes of this video, you are giving me permission to videotape this assessment.
Yes.
So the first thing that we're going to look for is we're going to start up here with the jugular. We're going to look for some jugular venous pressure. You want to see if there's any JVD, any distension of the jugular veins. I'm going to get you to move your head over to the left there so we can take a look here. We want to look and see the internal carotid is only, it's not visible. You can see the palpations at times. The sternum is here. This is the suprasternal notch there. Sometimes you can see a little bit of the pulsations happening there. All right, next thing, having you look straight ahead, I'm going to get some carotid pulses. And the carotid pulses, we're going to try and avoid the carotid sinuses up here. And also avoid palpating for pulses at the same time on both sides. It can cause hypotension. I don't need you to pass out on me. So I'm going to, wait a minute, I can feel it right in there and right in there, carotid pulses, there we go. When we look for when we assess our carotid pulse, we're looking for amplitude, the strongness, and the upstroke feeling of the carotids. We're also looking for, going to palpate for any thrills, and if we feel any thrills, which is kind of that purring, cat purring type vibrating, then we would listen for bruits. So I also want to take a listen to the carotids. I'm going to do the diaphragm and the bell on both sides, listening to the carotids. Okay, perfect. Okay. The next thing is I am going to palpate and down the chest here, just looking for any tenderness. Palpate the on the right here, the right sternal border where the aorta is, left second intercostal space where the pulmonic would be, and then down to fourth we would find your tricuspid. Down in the third, fourth intercostal spaces is where the Erb's point is. Erb's point is where you would, we'll do that listening later, where the S2 is heard very clearly down there, and then down into moving to the mid-clavicular line here in the fifth intercostal space is where the mitral valve. And then you can feel, if you do that, you can a lot of times feel the ventricle pulsations down in the fifth intercostal space there. That is where the mitral valve is located. Next thing is to auscultate. So cardiac, we're going to listen to the heart. We're going to start on the right, listen over the aorta in the second intercostal space. Actually, I'm going to start up here. Now I'm going to go down. All right, and then crossing over listening on the left, moving down to the third and fourth intercostal space, over the fourth where the tricuspid valve would be. And like I said, Erb's point is in the third, fourth, and fifth, and that would be where you would hear your S2. And then moving down to the fifth where the mitral valve is at, mid-clavicular. Okay. We're going to move on to the lungs. The right lung, right side, the right lung has an upper, a middle, and a lower lobe. The left lung has a upper and lower lobe. We're going to inspect, of course. We're going to watch. We're going to watch for respiratory rate, see if we've got a regular rate and rhythm. We're going to see whether it's shallow, whether there's any shortness of breath, whether you're putting out a lot of effort in your breathing. And then we're going to palpate, looking for subcutaneous air. And then the other thing that we're going to do is palpate doing tactile fremitus, and tactile fremitus is actually feeling the vibrations of when you speak. So if I could ask you to say 99.
99.
Go again.
99.
All right, perfect. And actually, I'm going to do it again.
99. 99.
Mm-hmm.
99.
All right.
99.
Perfect. Can definitely feel those vibrations coming through. Gonna auscultate. And when I listen, I am going to be listening for bronchial breath sounds. Bronchial breath sounds are more up around the bronchial area. Bronchial vesicular is down towards the middle, and then your vesicular is on the other side. Bronchial sounds should be more of the high-pitched sound. The bronchial vesicular around the second intercostal spaces should just be a medium-pitched with even inspiratory and expiratory equal time. The fourth intercostal space is where we would find our middle lobe on the right side, the right middle lobe, and then your vesicular down, and we can get down around the sixth intercostal space as well, is where you're going to hear more of your low-pitched sounds. So. All right, nice and clear. And we're coming down. Perfect. And then I'm going to try and get down in here a little bit more. And I can't hear anything through closed, so perfect. Good, perfect. Okay. Also, I want to listen to some voice sounds. I'm going to have you say E. That is our testing. It's called egotophy. Egotophy. I can't say it right. Anyways, we should hear
Egophony.
egophony. Yeah.
Yeah.
Should hear just a nice E sound. Go ahead and say E.
E.
And it is. It's a nice clear E sound. We're going to do the whisper pectorology, and I'm going to have you say 1, 2, 3.
1, 2, 3.
Mm-hmm.
1, 2, 3.
And that is just a normal muffled soft sound. And then bronchoscopy is, I'm going to have you say 99.
99.
Again.
99.
Uh-huh. And that is just also a normal soft. And then we're going to do the posterior lung. So I'm going to turn around all the way around so we can see. And I'm going to adjust this so that the video can see it as well. And up we go. All right. In the back, we have the right and the left, and you're not going to be able to get to hear anything in the middle lobe because of the scapula is here. We're going to listen to, we're going to inspect once again. We're going to inspect and watch the rate, the rhythm, the effort, the duration. If you could just do some nice normal breathing, and I've been watching you. No respiratory distress is noted. And we're going to palpate, and I'm going to palpate looking for any subacute air, then we're going to do the tactile fremitus on the back as well. So palpate using the pads of the fingers, looking for any subcutaneous air, and I feel none. And then if you could say 99.
99.
There we go. Nice vibration.
99.
Uh-huh. Okay.
99.
Hold on a minute. Sorry. It's just an awkward placement. Go ahead.
99.
All right. And
99.
perfect. Okay. When I listen to your lung sounds, I'm going to go down and do a Z pattern. We can start up here at the top around the C7, T3 area, and I can catch your upper lobes there. And then when we move down, T3, it's C7 to T3, and then T3 to T10, and upper and lower lobes. Okay. More. Good. Good.
My cough is better.
Huh?
My cough is better.
I know. There we go. And then I'm also going to do it. I did the diaphragm. I also want to do it with the bowel. There we go. Perfect. Okay. Wanted to, when I listen to your lungs, I want to listen for any abnormals, any crackles, which is the crackling sound like your hair makes when I rub it together. Listening for any wheezing, that high-pitched wheezing sign. It could be inspiratory or expiratory, and then also for bronchi, which is more of a rough lung sound. Okay, there we go. Let's turn you around here. I'm going to pull this over here so we can get some pulses done. If you could bring your feet up just a little bit for me there. Okay. Want to do upper and lower extremities, checking for your peripheral circulation, and looking for any swelling, edema. You are nice, pink, warm, and dry, which we all look for as normal. No edema. And then gonna check some brachial pulses. Okay. There we go. Radial pulses. They're even, strong, together. Like to check out your cap refill. And a normal cap refill is after I press, it should blanch, and then it'll pink up within less than 3 seconds. And cap refill is normal. Lower extremities also, going to look for any swelling. No swelling, no edema. Edema is usually rated pitting, which is the amount of time the depression, how many seconds it takes to release. We're going to look at the popliteal pulses, and to get those, we usually do a cupping back here. Bring your fingers in and kind of bring them out, and there it is. You can feel that. Pulses are rated bounding, +3 your pulses, 2+ is normal. And then 1+ is kind of a thready pulse, and then we can Doppler if we cannot get the pulses by feel. And moving on down, we've got the dorsalis pedis, which is at the top of the foot here. posterior tibial, which is inside the malleolus right there. Okay. And then also cap refill on your toes, which is good. Less than 3 seconds. And then that concludes our video for the cardio, lung, and thoracic. I think we did it.